monkeypox disease. With COVID cases on the rise in the region, the Pan American Health Organization, PAHO, is calling on Caribbean countries to do more to avert a public health crisis. Shamila Pullen tells us more in this report.
During previous waves of the coronavirus, hospitals have been stretched to the limit. Now a fifth is upon us, but the government insists that the country is better able to handle the crisis. But at Wednesday's weekly media briefing, Director of the Pan American Health Organization, Dr. Carsa Etienne, says countries must ensure that intensive care units, ICU, and hospital capacity are maintained so that services can be quickly scaled up to meet the potential demand of new infections.
Across the Caribbean, COVID-19 cases have been increasing for 5 consecutive weeks, with a rise of 9.3% in cases and a jump in deaths of 49% as compared with the previous week. 14 countries and territories in the Caribbean reported increases in hospitalizations.
Additionally, Dr. Etienne is urging governments to reconsider re-implementing COVID-19 measures.
Masking and social distancing have served us well since the start of the pandemic and are still valid measures to lower virus transmission. Governments should continue to monitor the COVID-19 trends closely, to adapt their guidance to protect the most vulnerable, and always be ready to scale up these social measures whenever there is an increase in cases or in deaths.
In the meantime, public health specialist Dr. Leslie Mead says with a low take-up in the vaccines, the government should curtail entertainment events in order to curb the rise in cases and hospitalization.
Our colleagues in Trinidad and Barbados are in the 50%. Those major trading partners like England is at 80%, USA at 67%. We have to get those up because long COVID is a real problem.
Shamila Pullen, TVJ News.